Hello, welcome to The Viewpoint. I am Mamadou Mbouch. Until some months ago, most people had not heard of the word, but now we are gripped, the whole world, gripped in its elusive, treacherous, highly contagious, and sometimes deadly reality. By my count, there are nearly 3,500,000 confirmed cases across 190 countries and close to 15,000 deaths. These numbers will, of course, change as soon as they tend to in these circumstances because it is a evolving reality. The Gambia has so far recorded 2 confirmed cases, and one of them died, unfortunately. The index patient, the first diagnosed patient, a young woman who had traveled into the country from the UK, was diagnosed on the 17th of March. However, the man who died was diagnosed came into the country on the 13th and died on the 20th. So, how prepared really are we to contain this rather ferocious enemy? To help me to answer that question, I'm joined today by the Health Promotion Officer at the World Health Organization, Mr. Mamadou Gassama. And I was also supposed to be joined by an official from the Ministry of Health, but unfortunately he had to cancel at the last minute because he had to attend to urgent business. Welcome to The Viewpoint, Mr. Gassama.
Thank you very much, Mr. Mbouch.
Yes, before we begin, I've said 2 confirmed cases, one of them died. By your count, do you know whether the numbers have gone up? Do you have any idea prior to your coming here?
No, I don't have I think what you have said is what I have, the same information I have. 2 cases, 1 died, and of course 1 is still is progressing. I understand the situation is improving. That is what I can give as an update, but I'm sure our government colleagues are compiling whatever, because these things is evolving, as you rightly said. The situation changes as we by the minute. So I am sure the update, the latest one, will be with them. Yeah, but as we speak now, this is what is confirmed officially.
Yes, that's it. So I wish that we had the government, the Ministry of Health official here, because this next question really would have been directed at him.
Yeah.
But you are also within the health sector, and you might be able to answer this. I do hear public health experts say that you impose, particularly in epidemics, you impose emergency measures even before the emergency begins. Do you think that we did that?
This is a very good question. Yes, this is a very good question. Yes, WHO, if you know what WHO means and what WHO does, we are the secretariat to the what we call the whole organization. WHO is an intergovernmental organization. It's member states, 194 of them, and WHO serves as the secretariat, the staff, including myself. We serve as the secretariat. So WHO is more or less is a technical organization. Now, being a technical organization, it means it has the expertise, it has the knowledge, it has the technical resources to be able to support countries, prepare them. In fact, emergencies, we don't wait till emergencies strike and then we take action. You'll be surprised. Months ago, WHO had been in close contact with countries, especially when this thing was discovered in China, and WHO's team already, of course, there is a local office in China. But at the same time, when this thing happened, WHO, of course, went from all the levels, at the regional level, and also at headquarters level, a team of experts. When I say team of experts, people with different skills, because when you talk about an emergency, you need a lot of resources in terms of technical expertise. So there are people who are case management experts. They know how to treat. And there are people who are logistics experts. There are people who are communication experts. There are people who are epidemiologists. They are the expert who can really tell you, they can forecast. They can tell you, what measures you can take and how disease is spread within the population. So you have that type of team was what was deployed in China. And but before that, when that was because it was only confined to, at that time, it was only confined to China. Now, what was happening at that time? Said China was not only China, yes, it was already there, but WHO says this, you cannot wait, because the world is a global village. So what do you do to prepare those countries which do not yet register a case? So what do you do? That's why the preparation comes now. Now, I'm talking about 194 countries. Now, China minus 193, especially low-income countries, developing countries. Of course, you have WHO is globally, all these countries, big countries are all part of WHO, but because our health systems are different, those countries that are really with weak health systems are really usually the priority. Because you cannot compare UK with the Gambia, you can't. You cannot compare US with the Gambia or Senegal. So they have already got strong health systems. So WHO's main focus at that time was not only concentrating on China, but also strengthening the health system of countries so that they can adequately be prepared, adequately respond when the need arises.
So how did the Gambia benefit from that?
The Gambia benefited from that because what we did was initially is to give all the technical effect, at that time, WHO country office, of course, through our headquarters and regional office, we've been really giving the technical guidance. Because when you don't give the right guidance, it will be chaotic. So from day one, we've been in touch with the Minister of Health that these are the realities and all the necessary information that you can think about, that government need. This has been WHO's country office business to really give that to the Minister of Health, the government for that matter. Now, again, of course, all the...
So was it just in terms of, you said technical advice?
Yeah.
What about maybe testing kits and...
That is, I'm coming now. You see, because what WHO does is like it divides the countries into 3 zones, all the countries in the African region, into 3 zones. Those that are very, very vulnerable. Vulnerable in terms of not only their health system, but vulnerable in terms of the human traffic, the human traffic. Countries that really are very busy. They have very busy airports. A lot of people are coming. Flights are all over coming because that can expose that country to risk. So another level where those countries that are below that are not very as busy as others, and but again they are all vulnerable. They also have weak health system. There are others that are very far from the hotspot, and they are not. Looking at them, they are not very vulnerable as others. So this is how WHO divides the countries, the 47 countries in the African region. Now, Gambia happened to be in those countries that are really, at that time, we don't have any case, number one. We also don't have, like I said, all that yardstick. We have not met all that. So, but again, what do you do with those countries? So each of those countries, you have to do something. Now, even us that we belong to that third group, we were really, there are some measures that should be put in place, just in case.
Which were? So
these measures were, for example,
the WHO do?
WHO exactly, like as I said, training of, because you need to build the capacity of health workers. You need to train them. You need to give them information. And that time, WHO developed a lot of guidelines. You see, because that's the WHO's technical mandate.
So training about how to diagnose,
exactly.
how to identify
exactly.
symptoms.
Those type of exactly. A lot of training guidelines. Because Ebola, we learned a lot from the Ebola epidemic.
But do you have any idea how many people were trained?
At this point in time, now, in fact, if I give you the latest one, because I'm not the program officer responsible for this, but I can tell you that of recent, not long ago, we had trained nearly 100 clinicians across the country. This was like in the weekend. A lot of doctors, doctors, nurses. So for that, you need to train a critical mass because otherwise, they are the ones who will be attending to these patients. So if you don't bring their capacity, if you don't build their capacity, then you may have a problem. So I can tell you that as I speak to you now, at least 100 clinicians, be it nurses, be it doctors, they were trained on all the things that you need. Infection control, number one, how to diagnose, how to treat, and also of recent WHO, not only training, but we also give some protective equipment and also diagnostic kits.
Yeah.
That the ministry can.
But you said okay,
those are all things that the WHO has. Because at the end of the day, at that time, because we didn't register a case, as I said, you don't need to bring all those stuff like that, and when they are not in use, you have to concentrate on countries that are really in trouble. Of course, you don't forget about countries that are not in trouble. That's what WHO is doing. So depending on the risk, that's why we always assess risk in the countries. and in fact globally, regionally and at country level. So you have to assess the risk. Then you know the position to take. And
Yes,
this was what dictates everything. WHO's operation.
But this is the thing. But in the case of the Gambia, when we didn't have any case at all, that was really when we should have come up with very stringent measures so that to make sure that it wouldn't come in. So this is perhaps one of the criticisms of WHO, in the sense that it got only one guidelines, as it were, for the whole world, but it is not specific. It is not region context specific.
It is. I don't know what. I don't think there is. That may be opinion, but let me tell you, a lot of things went behind the scene. You see, WHO cannot wait. We know that the health system, especially in developing countries, are very weak. What do? You have to prepare them, and that's, as I said, we are not a funding agency per se. Our business is to equip the health system, and given the strengthening the health system. You cannot talk about, you have to talk about guidelines. The guidance must be there, because otherwise it will be chaotic. If I don't know how to treat a disease, believe me, others are now mining the brains of WHO. That's why WHO is in the forefront, because that's our technical mandate. The whole world is looking at WHO, because if it fails, we have a problem. And that's where we want to avoid. As I said, Ebola has taught everybody, the whole world, a lesson. And now WHO wants really to avoid all that what happened, because you cannot point a finger at WHO alone. It's the international community. But it's our mandate to coordinate global health. But what I can tell you is that WHO has developed, you can name them, a lot of things. In fact, information that even you will say, I'm overwhelmed with information. Now, those guidance, you can, across the board, not only even, because when you talk about epidemic, you don't only talk about case management, how doctors strengthen. No, you have to talk about, you look at, infection control. That's a whole kettle of fish. How can you do this if you don't know, if you don't have the guidance? So the guidance must be, that's what WHO was doing well before, to prepare the and that has been disseminated, that has been shared, and that's what countries are now grabbing. Because if countries are at zero and there's an epidemic, what is going to happen? It's going to be chaotic. But thank God now those guidelines have been issued to all the countries. They are, in fact, sort of generic guidelines. They are not, so that you don't reinvent the wheel, because countries' context they differ. That's what maybe that's what you're talking about. Countries' context differ. Now, but WHO's business is to have a standardized set of guidelines that will help countries. Now, it's generic, of course, but it helps you to work faster, so that you don't have to reinvent. And these are these are prepared by technical experts all over the world.
But how influential is WHO in government policy, in determining government policy, helping them in strategy design and that sort of thing?
Fantastic.
How influential
Fantastic. WHO is very influential. In fact, now you are talking the nerves of WHO. If you told me now how much money we are investing, I will say maybe not much per se in terms of cash, because we are not a funding agency. But now you have touched the nerves of WHO's core mandate, because that's what we call governance. You need to strengthen the governance. The governance doesn't mean that politics. You need to strengthen those critical policies. They have to. The policy must be there. That's why even if you talk about our health policy, this WHO that really is the brain behind that, because you just cannot have, you just cannot grow up in the dark, Mr. Boyd. You see, you cannot grow up in the dark. And then it's just like, this is science. You have to have evidence-based policies and strategies, and that's what WHO's mandate is. So we are very influential in terms of policy, influencing policies at country level, because that is our core mandate. We give them, the ministry, the evidence now, and we also bring the technical expertise to help, not only bringing guidelines, developing guidelines, but also we bring the expertise on the ground to support nationals, to make sure that they have those critical policies and strategic plans that are needed to tackle any other disease. In fact, a good example is the health sector policy and strategic plan. That is a baby of WHO, because we know that without that health policy and strategic plan, we are nowhere. So the country is good news that the country has a strategic plan for health. But even this emergency thing, maybe you want to say.
Yes, I just want to ask this. But how involved is WHO in monitoring that the guidelines are implemented?
Very good. Yes, we do monitor, because remember, WHO is a secretariat to the 194 member states. And WHO constantly monitoring and evaluation research, those are critical core nerves of WHO. So what we do is like we have to, of course, there are questionnaires, there are sometimes either a telephone call or teleconference, whatever. But we have means where we monitor, because at the end of the day, every country has to do ABC. Because especially now for this type of situation where we find ourselves, WHO you have monitoring checklist that needs to be answered by the countries. We don't go directly to do all those, but we need to also do the checklist, because there are times experts will come and try to assess. I remember very well a team of experts came here to assess WHO Gambia's readiness to emergencies. You see, that's what I'm saying. Those are one of the, you see, that really found some good news and some little bit of weakness in some areas. But the thing is that
a little bit of weakness. What do you mean, a little bit of weakness?
No, weakness in terms of when I say weakness in terms, I'm talking about maybe the human resource capacity is one of the, because no country can, like Gambia is just like any other developing country. We cannot have all 95% or 100% of our human resources need. That's not possible. So you need an emergency also. You need a lot of experts, in this area. But as I said, Gambia has done well. I better say because that we are not praising. We are not praising because we are secretariat. But I can tell you that out of the checklist, we are better than many countries. I'm not sure exactly the percentages. I don't want to do any judgment.
Granted that, but again, we've been sending our reporters, for instance, to go around, for instance, the border posts, to say how porous they were, how prepared they were, whether you had medical personnel, whether they had isolation centers. But again, what we reported back was really less than what is desired in many ways. So I'm not sure what you mean by there are little bits of problems to some people.
No, what I'm saying, that one was not
significant.
Maybe you should make it clear. That was not this coronavirus disease. That was way before. That was last year. That was,
this
as
is
I
recently.
said.
Our reporter went
so if that assessment is
Jiboro,
on, Jiboro, okay. I may not be the, because this is government. I may not be the one that can really give you that true picture. But what I can tell you...
But merely for the WHO, what does the WHO think, given the state of preparedness of this country? That's really what one is trying to explore here. Because we know that before we had any case, so we were getting lots of information that we were getting prepared at all entry points. And here we've seen at the airport, 2 people just came in. One person came in from England, another one from Senegal. So we can see that there are gaps there.
I will not dispute that. I will like it's any other country. See, I'm not defending anything here. I'm being objective, and I think we also have to. We don't only have to look at the gaps. We also have to look at the strengths. I'm sorry, many people only see maybe the gaps or the faults or the weaknesses.
But don't you think we should
focus
on the gaps to
there is room
redress
for
them?
improvement. Yes, I will always say, to be honest, to be fair judgment, there'll be room for improvement. That I can accept that. But what I think is not what is not very fair as a statement is that maybe government is not doing anything. I think usually this is where people are desperate. They want to see some information.
One is not necessarily saying that government is not doing anything. Obviously, government would do something. But again, it's also good to concentrate on what is not going right, so that one can
rectify.
I
agree. I wholeheartedly agree with you. But I think this is something that probably our government colleagues are listening. But as a WHO, we are independent. We don't want to go into any politics. But what is happening?
True, but you do make your assessments.
We make our assessment, and then of course we know that wherever the gap is, we really try and give the necessary support that we can. And as I said, our comparative advantage is to give that technical resources, that technical capacity. You have to, otherwise others will, because if you don't look at strategic areas, when disaster, because some people will be talking, their journalists are important, others will be doing whatever but if the core, the nerve, the health system, which is the nerve, is weak, oh my God, we are in trouble. And that's where WHO's comparative advantage is. And that's why we don't joke with that. We make sure that that is strengthened. And that being strengthened, like health workers, number one, their protection. Their protection in terms of equipment, their protection in terms of knowledge. The knowledge is key. You and I, who don't probably know how to manage this case, what will happen if we are confronted with this type of thing? So the health workers must be very much prepared, and then by extension is the health system. So now I'm talking about why it is important to get this thing done in terms of the health people. Why is it important to have to equip the health system? You see, when you talk about the health system, people only think about maybe it's only people who are working. No. It's not only the people who are working, the nurses and the doctors, but also the equipment. That's, as I said recently, we brought those critical, because Gambia at that time we didn't register any case. And as I said, those preparatory measures, those equipments that they need, critically need, to be able to diagnose, because they're at risk if they don't have this equipment. Now, for that to happen, we need to really work very fast. And that's why, as I said, we brought that thing, and then the minister received it. And I think it was a preposition. And
was it enough?
No, at that time, that time, it can never be enough at that time. It was not enough. Now, what we can do, because Gambia has a case now, obviously there is already some WHO has prepositioned some equipments and supplies in Ghana, because Ghana is our just for strategic reasons. So when cases start coming now, I can tell you, WHO is fully aware, because we are aware that government, what is happening here, because it's an obligation for any country to supply, to give, whatever information they have on this coronavirus. Whether you are having cases or whether you don't have cases, whether you report or not, you have to supply information to them. There are set guidelines that you do that. So that at the end of the day, that is where we call SITREP, situational reports. Then you have to tell us how many cases you have, where they are there, what are the gaps, what do you need, those type of things. Then you send, all the countries have to send, whether they are reporting it or not, whether they have cases or not, this has to be done.
And then afterwards?
So afterwards, now when countries do that, then WHO will definitely respond accordingly. WHO will respond accordingly. And as I tell you, it's not only even bringing those supplies. It's also WHO's work is beyond that also, because you can imagine some of those.
So is it that whatever we've required from WHO, they've sent it? Would you say that?
At the point in time, everything. No, I wouldn't say everything that we have. I cannot say that. That everything that we need, is all given by now. Now, because we are just starting, I said the situation is evolving. What people have to understand is, I fully agree with the layperson in the street. Oh, I need gloves, I need mask, or whatever. But you also have to look at the risk. That's why I'm going back to what I said before. WHO does not work in darkness. It has to, it creates evidence. It generates evidence. And that evidence is, if you look at the situation report about this, WHO at that time was classifying countries when only China had it and the whole world was, how are we faring? Is the risk high or is it low? In fact, China at that time was higher. The world is somehow low, and then, some countries were very low. But you see now, because it's a pandemic, everything is high, because we are constantly on the ground assessing risk.
Well, was WHO taken off guard? Was it prepared?
Oh, yeah.
For the eventual pandemic?
Oh, fantastic. Oh, yeah. Because WHO, as I said, experts on the ground who are projecting, because you can look at the dynamics of the outbreak. You see, WHO constantly is engaging the top scientists in the world, in addition to the in-house experts. That is WHO's core. Our Director General, when this started, was really engaging those top medical scientists in the world that you can never dispute their.
But still, it didn't stop the epidemic moving on, blowing over into a pandemic. It didn't stop it either.
In fact, the thing is, Mboch, that we have to draw a line here. Now, science and technology. You see, science and technology. You see, technology in the broader sense, WHO cannot control, movement of people. You cannot. That is not our mandate. You see, in epidemic, you must have to understand that it's not only the disease that we are after, or the virus, or the germ, whatever you want to call it, but also the impact of that. Like social impact. That is not WHO's core mandate. Of course, economic impact. What is this? If this happens, what is going to happen? You know, WHO is not the organization that will say, let me give everybody $10,000 for their daily feed.
No,
That's
not
not
necessarily give
So what
money,
I'm saying is now I'm telling
you the analysis.
Yes, the analysis now we know that we know that because it's just a matter of time. Even in the Gambia here, our preparatory messages were it's just a matter of time. We are all doing our best because look at it, Senegal has got it. So if anything is in Senegal, we are already there. And when we keep hearing, even at that time Africa had no case. But WHO's message is this is just a matter of time. Because we are seeing the dynamics. It started with one country, and we saw it like going like wildfire.
But this is it. This is why some people
now
say
when
that our state of preparedness, and given what we knew, and there was a small window of opportunity for one to really bring in the right thing, solid structures. It didn't really
happen. Maybe we have to divide. We have to draw a line here. What is the technical? What do you need as a technical guidance, as something technical resources that you need? And again, what can the country do in terms of those logistics, those political decisions? You see, now this is why you have to draw a line. I know for the technical aspect of it, WHO's mandate is that. But when you come to taking strategic decisions, for example, all those measures that came out. You know, WHO, I mean, of course, countries, they assess their risk, it depends on their risk again. When they know that this is very risky, because let's call it spade a spade. You don't want to explode when the risk is not high and you want to explode it and then bring confusion. You cannot do that. You see what I mean? Now, but when the risk is high, you also have to. That's why countries are taking different measures. Some of these measures were not taken before. Now, this lockdown in some countries we are seeing, they were not done before. But now we are seeing countries are doing. Why are they doing it? Because they have assessed the risk.
Yeah, because they've got extra cases. And
exactly.
But with us, at a certain point, of course, you don't have to be alarmed, but at least be alert, as they say, be alert, not alarmed.
Yeah. I know.
That's it. So it was this state of alertness. I mean, when it comes to public information, there wasn't really that much. People had their own views, even socially, because you needed the government really to prepare socially, to prepare the people socially, you know what I mean? Because they'll have to contend with certain social habits that might not be very helpful in tackling the disease. So a lot of people are saying that the state of preparedness do not know what WHO thinks. Maybe you will tell us, what does WHO think about the state of preparedness of this country?
Okay. State of preparedness, what does that mean? If you open that box, I will say, I can tick one state of in terms of the technical knowledge. Yes, we were there because.
So we had enough trained staff.
We cannot have say all the health workers, doctors are trained. We cannot say that. But what I can tell you that is the most critical thing first to do before anything else. Because if your health workers are not prepared, they are not equipped with the information, believe me, we're going to have disaster. And that's where WHO's first thing is, how do we get the health system? And that's now I'm talking about the health system. And now in maybe to bring it down to another level, like health workers. The health workers must be capacitated. They must get the capacity first. And then what do they do now? How to protect? They should be protected, because in the event that there is a case and they are attending to a case, they need to be protected. So all those things that we were doing, those are the critical ones. Those are the critical ones. Now, in terms of information, WHO, as I said before, all the necessary things have been given. You know, we have been sharing, because that's our core mandate. Get the guidelines done. You know, let the countries not suffer. Let them use those guidelines. You know, contextualize them, adapt them to their local context, and then move fast. Because when emergency comes, you have to move fast. So that type of thing, and of course, there is already an international health regulation. You see, this thing has been going on. You see, we have learned, as I said, when this thing happened, let me tell you one thing. You will now see where we're coming from. You see, Gambia was fully prepared for the Ebola epidemic. We had already the structures in place. We already had those type of course, Ebola is different from this disease. But what I can tell you is that those critical things that you need to be on the ground, borrowing from the Ebola epidemic, they were all on the ground. For example, rapid response team, where, for example, if somebody is sick, You call 1121025. You don't have to go out. You have to just call that number. There'll be what they call rapid response team that will quickly respond. And if there's that case, they know what to do with that. Those were all existing in the Ebola time. That's why you have to look at the context.
That's it.
Now,
but again,
what we do now, instead of reinventing the wheel, what WHO is, you cannot reinvent. Why not reinvigorate? Make those things, strengthen them.
That's it. But again, talking about context, we should also extend it a bit further.
Yeah.
With Ebola, we didn't have any case in this country. So we can say that perhaps our preventive measures worked. Here it's beyond that. Now it's within.
Yeah.
So we didn't really test our system for containment, how well it can contain anything.
Yeah.
So everything was just written down.
Yeah.
Everything was written down. So now we are having to test our system. Really. We've never had this chance.
You remember, because this is all part of what we call a very comprehensive. If you want to really address emergency, you also have to. You are talking about something very important, which is the simulation now. Simulation, because WHO also does not only tell countries do ABC, but it's also, countries also have to test what they call simulation, test those resources, test those systems, you see. So it is something that already, as I said, all those is a whole package, and that's part of it. So I better say, I want to be objective. You see, I'm not saying, government is not doing this, government should not do this, but what I'm telling you now is what is the ideal situation. And I wish our government colleagues were here, but as we see on what we see on the ground and what we have done, to be honest with you, I think that has been a very good level of preparation, because preparation does not mean you are treating, you are not responding. As I said, there are set guidelines that you follow when you are in different phases. When you are in the preparatory phase, you don't necessarily have to behave like you are responding. Of course, you have to be prepared. And that preparation is now confined to some few measures that you need to take. And now when you see the case, now you are responding. That's something else, you see. So this is where, as I said, maybe this is where I said we have to understand the two levels, the two scenarios. Now, what was happening before we had the case? I think we were doing our best. We were doing our best because those some people were trained. Of course, we make sure that all the necessary things that are in terms of technical resources, guidelines are in place, and government is aware, and government is always is being fed, is being given the information. When I say government, the Minister of Health, working very closely with WHO, and WHO was sharing, because that's one thing that WHO was doing, sharing those technical resources with countries, prepare them. And not only case management, even risk communication, even logistics. All these guidelines are there. Case management, and you name them. Even in terms of infectious disease, infection control. All those things are part of the whole thing. Emergency framework is very wide. It has all the things that you can think about.
So WHO really did what it could.
Yeah.
If there are any shortfalls, any shortcomings in our defense, perhaps that is because of government.
Yeah.
Is that what you're saying?
Well, what I'm saying now is WHO has done all it can. Now, government, I wouldn't say they have failed in what they are supposed to do, but government, because we are working with them, we know. When you are training, you don't train people from the sky. You train people who are part of the government. So I can say, what I can say is there is room for improvement. You see, let's
particularly in what areas?
Looking at the health system.
Areas do you think that there's room for improvement?
Which one?
I said particularly in what areas do you think that there's room for improvement? As you've just said. You said there's room for improvement.
Yeah.
I said particularly in what areas?
No, particularly in what area? You see, now we need to, you see, emergency is everybody's business. You as a communication expert, you have a very important role to play. You see, room for improvement means we need to, I am glad it's happening now, but we need to, emergency is beyond Ministry of Health, it's beyond one institution. So we have to make sure that every hand is on deck. That's number one. Number two, emergency is not only for even government, but what about the communities themselves, people themselves?
But doesn't the government set the tone? Isn't the government provides leadership?
Yeah.
Clear direction and leadership, then people can follow.
Yeah.
When the government doesn't have any it's not showing any leadership, then it's difficult for people to follow.
Well, I don't know what you mean by leadership. Anyway, leadership, I think I will disagree with you that.
No, because you said that it's not just government.
The leadership is there. The leadership is there. I agree. The leadership is there, but I don't also agree that we don't have the leader. The leadership is there because what I can tell you now is, without the leadership accepting what all that I was saying, there will be nothing. If, for example, the ministry say, well, WHO, we don't, no, we don't want to, these guidelines, no, or this advice, no, we don't take. Then say something, then I can say something's wrong. But as I said, government or the Ministry of Health and WHO, we are working hand in glove.
Absolutely, they can take the guidelines.
Now the guidelines are, and they have done. They were doing, and I'm sure
that the problem can be.
You know, and I'm sure that you know already. You can attest to it. There are a lot of things happening. There were a lot of things happening. Maybe you can tell me, maybe communication why maybe not everything was communicated. You know, maybe at the right time. But I can tell you that a lot of, like as I said, now these are not hidden. They are there for the public to know. What is important is that preparatory thing was happening, because in the first place, I think you remember that even the Ministry of Health, what we call the restructured or strengthened or reactivated, if you want to call it, the national response, emergency response task force or committee. That was very fast, because when we had, and that was before the case. So government could have said, no, we don't have a case now. That emergency thing, let's leave it. But it was a very good move by government, and WHO really thank government for that, because otherwise, if he didn't do that, what will have happened? And the second thing also, they quickly put into place a plan. You will see in the papers that even that has been endorsed by the president. That plan also, because I said, without a plan, both you'll be grouping in the dark.
Oh, absolutely. But
so
again, plans must be implemented.
And now that plan has just been endorsed. And I think it's being implemented, because when you say plan, implementation there are different phases. There are different facets of
Of course. But I'll ask you this: the WHO Director General Ghebreyesus Tedros once said that he's got only one message: test. So one wonders. In this country, yes, according to WHO, do you reckon we have enough testing centers covering the whole country?
Well, I cannot say exactly. I cannot answer that question very well. What I can tell you from the information that we, of course, get from our meetings, I know that there are isolation centers, in the health facilities, major hospitals, I think, and major district hospitals and major hospitals, where there are cases, they have facilities where you can isolate patients, because this thing is a very contagious disease. You cannot mix it with other patients. So you have to have strategically each of those critical health facilities. They must have to have an isolation center or something like that. But I remember the minister was saying this, which is a good move, because otherwise, if you don't, these are all part of the preparatory measures. See.
Absolutely.
As I tell you, that's why I'm saying preparatory measures are, it's not only, you see, those are all things that government did. And if they say now, we don't have isolation centers, and only start when the you start cracking your brain, what do we do? No. So those are all things.
But according to WHO, do we have enough of these across the country?
I will not say yes or no, because I cannot, I am not the maybe authority on that. But what I can say is something is in place. And I think we have to acknowledge that. Something is in place. That, of course, even if you have those things, you still need more. It cannot never be enough.
That's it. But then
it can never be enough.
But this is
because when you have again, you also look at your risk. You also look at your context. Now, if you have few cases, obviously we have not gone to a stage where we are overwhelmed. We can say we are still overwhelmed in terms of one case is even overwhelmed.
But that's how we must prepare for
that
right.
Before
the health system is overwhelmed.
But when I'm saying the real sense being overwhelmed, where you have transmission, local transmission. Now we are talking about maybe somebody, an imported case. But where we have really active local transmission, Yoro giving to a party, Gasama is giving to somebody, or one village to another. When we have that type of thing coming in full force, obviously the way you will respond is different from when you don't have a case, or it's different from when you have 1 or 2 cases. In fact, WHO has set guidelines for all these things. When you are preparing, when you have 1 or 2 cases, or when you are having full-blown cases. So you can see all these things are there. That's why I'm saying WHO was doing all these things to prepare the countries. And these are the things. So they know already what to do. Because the worst thing that you can do is when disaster strikes, you don't even know what to do.
So you think the country is prepared for when we get a spike in the numbers? Because this is the pattern that we've been seeing in other countries.
Yeah.
First you have a few, then it reaches a certain point, then it accelerates before it peaks and then declines. So do you think we are well prepared for any spike in numbers? So far, officially, we are told 2 confirmed cases, and you know that these things will change. So when we reach that acceleration point, would we not be overwhelmed?
I think, you see, even the developed countries are overwhelmed. You see, let's put that into context. Even the developed countries, we all know what is happening. Now, for our own case now, I know that those very good things that are in place, but I know that it's never enough. So what I can tell you now,
but shouldn't there be a critical
what I can tell you now, Mboj, is that you see, let's also be objective here. What I can tell you now is, we have not reached that state, but this is the mindset of the ministry, and this is what WHO and Ministry of Health are working on. Let me tell you this. We are not sitting down like, well, okay, it's only 1 case, so no business as usual. You can see even the measures that were taken. Some countries did that because they only came to that point then, you know, a good example is social distancing. They only did that when it was almost late. But look at it now. We only have 1 or 2 cases, and this is a very difficult situation, a very difficult decision for government to take.
So we do not really know how many undetected cases are out there.
So exactly, and then if you don't do that, so if you don't do those measures, because that's not WHO but it's government now, so that shows you that people are very serious about this, and people they really know the risk, and that's the good news that sometimes the disease can do. When you hear from what you can learn lessons from other countries, you know, like I said. If government could say, no, we have only 1 case, why should we ban, you know, those travel restriction and other quarantine and many other things?
But why even the travel restrictions came much later. Yes. So, and even when you talk about quarantine, I wonder how WHO felt when they heard that apparently 14 of a certain group of people put in quarantine, 14 had escaped. So
we know that this thing happened, you see, because of the fear. I was in Sierra Leone, the Ebola epidemic, what they even do, you know, sometimes, you know, like in a quarantine camp, whatever, you see a soldier with a gun, you know, so that nobody escapes. I saw that in Sierra Leone 2014 and 15.
But when you quarantine,
now you quarantine,
you must have security.
Exactly,
you have to provide
you have
security.
to provide it. And then I can see that even this type. I mean, we had a meeting 2 days ago. And the meeting, I was very impressed where people are they are quarantined not as seen as people who really are just ordinary human beings. They just dump them there. No, but their quarantine centers are decent. They have water supply. They have, I think, the hotels. Some of the hotels, I cannot name all of them. But where these people are housed.
Where in this country?
What is important?
Where they're taking them to quarantine them.
Yeah, the quarantine, yes. So that quarantine is just about restricting the movement. There are people who are not sick yet, per se, who can really. So they are there because they are coming from.
Because they pose risk.
Exactly. So what do you do now?
That's it.
So if you don't do that, because that's a very good move of the government, if you don't do that, those people can be now mingling with the population.
That's true, but there was no security. 14 escaped.
Yeah. So I don't know. I cannot answer that question because this is purely me. We are talking about science. You know, we are not talking about politics here. But unfortunately, it's unfortunate that what has happened, they escaped. But also you have to go in. I am sure the security people are also taking measures. I was in one meeting.
But don't you think it is important? It is important. Perhaps
the security chiefs are doing a lot to maybe. To tackle that type of situation.
That's it, but again, we need the WHO really to be very, very strong. Sometimes when the government is doing something that they shouldn't do, perhaps the WHO should come and say so. This is really an emergency. It's a matter of life and death. So perhaps shouldn't we go beyond the diplomatic niceties and all those felicities when in the face of this tragedy, really, potentially.
I agree. We do that. You see, we don't want to just say criticism for the sake of criticism. WHO offers honest technical advice in a very, not of course in a diplomatic way. You cannot say, when even a child, your own child, when the child does something wrong, you just cannot just shout at that child. You have to talk nicely. That one is just for courtesy. But WHO gives honest advice because we have all the documentation of epidemics. We have documented good practices. You know what has worked in scenario A in another country. What has not worked? Why has it not worked? Why has it worked? That type of thing will help. And when we are engaging government, these are the things we tell. These are the advice we give. It's not only from books. You know, of course, the books, the generic guidelines are there, but also expertise, people who have experienced these things, and they know not those things that you cannot get from the book. They are there. In addition to those guidelines, we also give those type of advice. We honestly, if you don't do that, that means WHO, we have failed. That is where our core mandate is, and that's what we are doing. And as I said, some measures need to be taken by government, not necessarily WHO, because that's not our core mandate. If you tell me, like I said at the beginning, if you tell me WHO to give money to people when they are hungry, that's not our. That's another. No, I'm giving you an example.
Not. Yes,
what I'm telling you is you have to understand our core mandate here. And I agree with you what you're saying that how do we need to do more? We are giving the advice that is required. We are giving the technical support that is required. Now, government is taking it, to be honest, because all those advice, you will know, maybe you are behind the scene, you don't know what's happening, but WHO is fully engaging government in those directions and then giving all the necessary technical resources that they need.
But this is it. Maybe some people are saying that perhaps they should have done more because we've realized that they did some studies, especially with the HIV epidemic in South Africa. Yeah. They realized that local context matters a lot. It can neuter interventions that had worked elsewhere. Yeah. So it is good that we compare notes, but because of the local context, you might bring in a solution that had worked elsewhere, but it wouldn't work here because of this. So this context, this specific analysis of the situation, so that we can come with solutions that work for us. Shouldn't WHO be helping towards that as well?
Well, I think we are doing that. You see, as I said, maybe you didn't get me. You see, these good practices, we share. If in the meetings, WHO experts, in fact, as I speak to you now, we have repurposed our office. You know, this is emergency. We know we were prepared before, but now it's not preparing, it's responding now. Now, responding means you need to really go beyond the normal thing. We are now in real war, where we have gunshots. You know, the enemy is attacking us. So what do we do now? We have to now those things we have changed it here. Maybe at that level, it's only preparatory, that language, but the language has changed now. And as I said, this is evolving, and believe me or not, this is going to be the direction WHO will take, and making sure that the ministry is equipped at the hour, at the minute, you know, to make sure that they know what should be done, and also what other extra efforts that we can bring back. Because as I said, now we are responding. We may get more, as I said, more support will be coming. As I speak to you now, because that's what WHO does. As I said, based on the risk. You see, people seem to see only a minute element of it, you see. But they don't see the whole, they only see the surface. But deep inside, they don't know. Because unless you know the technical mandate of that organization, then you may be. Because I am seeing some people, where are the gloves? And even as I speak to you now, the World Health Organization is saying is engaging. In fact, is appealing to the industries, for example, those that make this mask. The world needs nearly over 89 million medical masks every month for this epidemic. Can you imagine? So, what WHO, as I said, WHO is not only seeing the virus, is seeing the impact in different directions. It's working with even experts, economic experts. Because when you talk about health, there are implications, there are determinants that affect health. And economic is one of them. If people are not economically strong, They cannot, of course, if they are poor, too poor, they cannot afford the health services. You see what I mean? So all
true.
these things are being done as such, and scientists are also working on, even the drugs that you're talking about, even the treatment that you're talking about, the vaccines that everybody needs. WHO is, in fact, not only, as I said, looking after those who are sick, but also engaging the international experts to get these things, the solutions, as you were asking, so that we can help the country.
Absolutely. But you see, now somebody can pick on one of your one of the solutions, one of your the guidelines is part of your guidelines, one of the measures, social distancing.
Yeah.
Now imagine in a society such as ours, where people must commute to work. You've seen our public transport. Many people live from hand to mouth. So some people are saying that this so-called social distancing, very few people, the privileged, can really afford it.
Yeah.
When you come to our houses, I mean, shared accommodation. So how does one do this? So this was the point being alluded to, that perhaps WHO could have looked at Africa, our specific situations, and perhaps help in coming up with ideas, policies that would cater to our specific needs. Because here, social distancing, what would it mean to a lot of people? How could it work?
Very good. You see, social distancing, again, as I said, this is one of the measures that a lot of countries are taking. And WHO, of course, we have seen that it has reduced. You see, the thing is, let's people understand this. You see, there is a distinction between our culture, our way of life, and death. What will you, let me ask you this question too. What will you do if I should tell you that, leave, temporarily suspend, because we know the disease? Because the worst that you can do is when you grow up in the dark. But we have good news. The good news is that we know the disease now. It used to be like we don't know what was happening in China. We now know, the whole world knows now, COVID-19. That's one. Now we also know how this disease is transmitted, how one can protect themselves. Now, are we now saying, well, this is because, let me tell you why the confusion is coming, because human freedom, our culture, our freedom, once you start encroaching on that, then you have a problem. Now, what these social systems do, there is a good reason for it. The reason is that because when you are seeing a lot of cases that are coming, what do? Do you leave people to be transmitting the disease, and God forbid, and we have so many cases and people are dying in numbers, or do we have to temporarily suspend and adjust? Because we are human beings. If I don't shake, for example, if I don't shake hand with you and I understand, you will understand me.
But that is the easy bit, really. Yeah, imagine right now, what do we have? We've got really the affluent who are going to do the panic buying, they're stocking up. Poor people who live day to day, hand to mouth, how will they stock up? So some people are fearful that perhaps the measures we are implementing right now to staunch, to contain this disease, possibly the measures themselves will possibly claim so many different lives.
Yeah. You see,
so
you have to strike a balance. You have to strike a balance here. You have to implement measures that are, if they're in the public health interest. You have to assess, what am I doing? What am I doing now? Is it going to help me solve my problem maybe by 60, 80, 90%? Or is it only going to help by 20%? What will you do? You will go for things that can help you attain 90%. You see, this is what you have to understand. Now, I am bringing in a measure. I have to look at the public health dimension of it. And if you don't understand the public health dimension of it, if you look at only 1, 2, 3, of course, some people will suffer. Of course, I agree with you. But what about if the majority is protected? What will you go now? What will you go for? Do we leave few people just because, yes, they cannot afford it, they cannot cope with this, and now the majority is to suffer? What will you do?
No, but this is it.
No, I'm giving you now.
I know, but here the majority, in many ways,
so what I'm
most
saying
people
now, I think we also have to look at the rationale. The rationale is there to protect. There should be we should have a leeway for this also. We should also accommodate certain things, because this measure was not announced 2 months ago. Whoever had it? Nobody had it before. But these measures are being done now to protect you and I, our families, and the general population. So that has to also be, there are implications, definitely, yes. There are implications wherever, even the developed world, where these lockdowns are, obviously, you know, people are, they cannot go out, maybe they have enough, they don't even, some may even have enough food.
But
because
again,
remember, poverty is not only in the Gambia, but poverty is also in
but
Europe.
This is the thing,
places.
but again, you
so
go to Britain, you go to America, go to America now, we all know that they've got the stimulus packages to help disadvantaged groups in all sorts of ways. We say that in our society, our government is going to do that. I wonder what the WHO can do to help. But just one more thing. We understand that the Chinese billionaire Jack Ma has given us resources, money, help, I think, taken to masks and protective suits and that sort of thing for Africa. One wonders who's distributing it. Is it the WHO?
Maybe. I don't have any information on that. But I can tell you that WHO is working very closely with different organizations, different institutions, because that is where some countries will say now, or some philanthropists, some institutions will say, because they rely on WHO, because of our technical mandate, and of course our leading authority in this area, they will probably partner with WHO and give them whatever, and then WHO will definitely do the necessary distribution to the countries.
Okay.
That's what.
Thank you very much, Mamadou Gassama, the Health Promotion Officer at the WHO.
Thank you very much. Thank you.
And of course, thanks to our viewers. Let us play it safe. Let's follow the expertise of WHO, their advice. Wash your hands constantly and avoid touching your face, and try to be hygienic and be careful where you get your information. You know what goes on social media. Go to reputable sources where you will get your information, because here we have to get the science right, really. We are all in trouble. Thank you very much. Take care. Until next time, I'm Woodimboch.